Hello, everyone. Welcome to the Intimate Care Products 201 series. We're just going to give folks a minute or so to come on. But while you're joining in, please feel free to introduce yourself in the chat and get to know all the other folks that are here attending the webinar as well. All right. Well, let's get started and then we'll have other folks join us as they come in. So welcome everyone to the Intimate Care Products 201 webinar. Our 101 series is a webinar series where we go over kind of the basics of our work so that we can continue to build off of that in terms of education, science, advocacy, and all of that. So if for those of you who are unfamiliar with Women's Voices of the Earth, we also go by WEAVE for short, but we are a organization that drives action towards a future free from toxic chemicals and their impacts rooted in gender justice. And you'll learn a little bit more about the work that we are doing as an organization. And also you're joining us during a very special week. We are currently in the middle of Vaginal Health Week, which I'll share a little bit more about as we go on. But welcome to all of those who know who we are as an org and those who are new. So Women's Voices for the Earth, although we are a national organization, we have an office in Denver, Colorado. And so I want to, before we start off, just acknowledge the land that we operate on was unjustly taken from Indigenous tribal nations. I am currently located on Ohlone land, and we will be dropping a link in the chat for you all to see like where you are located as well. In terms of land acknowledgement. So welcome. I know we have people joining from all over, so excited to hear and see where everyone is joining from. Next, we'll go into introduction. So my name is Jayla Burton. I use she, her pronouns, and I am the Director of Programs here at Women's Voices for the Earth. And I'll pass it on to Alex.
Hi, I'm Alex Scranton, also she, her pronouns, and I'm the Director of Science and Research here at Women's Voices for the Earth. Happy to have everyone here.
So the goal for our webinar today is just to create a welcoming, inclusive, and accessible space for a community to learn about intimate care products specifically, some of the reasons that they're used, what are the chemicals that are contained within them, and then also we'll go over a little bit of like the systemic issues around intimate care products as well. So feel free to, no matter where you're coming into this topic from, ask questions. We do have a question and answer feature that is a part of this webinar. So we'll try to answer questions as we move forward, but if we don't have time to do that in the chat, or there's a question that is just better fit for answering verbally, we'll get to that at the end. And then we'll also wrap up with just showing everyone and letting everyone know different ways to take action when it comes to how to have more power over our intimate care products. So that's a little bit about what we'll be doing today. In terms of our community agreements, one of the things that's really important is being present, listening, and being open-minded, leaning into discomfort, taking up space and making space, keeping it respectful, inclusive, and if anything is discussed in this space that needs to be confidential, just keeping it as that. One of the things that I also want to preface as well is that we are going to be talking about vaginal health a lot, almost in every single slide. And we are not here to shame anyone. This is specifically for us to have the information that we need to be able to like navigate as consumers, as advocates in a world. We're all striving to live in a healthier world. So yeah, our goal is to offer you the information and then you make the best decisions on what is best for your body, your life, your routine, and all of that using this information. Yeah. So like I said before, we are in a very special week. So our Intimate Care 201 webinar is a part of our Vaginal Health Week, which is super exciting. So we are currently on day 3. Vaginal Health Week this year is focusing on different days of action. So there's a little bit for everyone to do. We started off the week with inviting people to share their stories about intimate care products and how they've been impacted by them, by specific products from different companies, whether it's questions that you might have or experience that you don't quite know what's going on, but you have a shared experience as someone else. And so we invited people to participate in that way on Monday at the launch of Vaginal Health Week. Yesterday, we invited folks to take action on a continuing campaign that we've been doing for quite some time, the Summers Deceive campaign, which I'll tell you all a little bit more how to take action there at the end of this webinar. And then today, of course, is attending the webinar, and then throughout the week we'll be launching another action on Thursday, so that's tomorrow, where we'll invite folks to leave public comment on an FDA citizens petition that we filed. And then on Friday, we're going to be inviting people to host our Stories Our Flow workshops within their own communities, and then continuing to support Weave's work through raising awareness and donating as well. So that's what Vaginal Health Week looks like. We'll go ahead and drop in the chat a link, or you can scan the QR code, and that will take you to our webpage. That'll show a little bit more of the specific breakdown by day of what it is that we're doing and how you can get involved. So definitely looking forward to engaging with you all, not only today, but throughout the week. So before we get started with just sharing a bunch of important information, I wanted to get this conversation started about what products do you think of when you hear the term intimate care? And so I'll take a moment to have everyone kind of reflect, to think on that, and would love for you all to share your responses or your reflections in the chat. So we'll just take a little bit of a moment to do that. Okay, we have some folks saying lubricants, yes. Yes, douching, yes, douche products. Yeah, those are exactly what is inclusive of underneath the term of intimate care products. Vaginal washes and wipes, exactly. Yeah, awesome. Well, as things keep flowing, feel free to drop them in the chat as you wish. But without further ado, what we'll do is I guess we'll pass it along to Alex, our Director of Science and Research.
Great. Let's go to the next slide. Okay, so yeah, these are just to get a sense that we're all on the same page of what products we're talking about, and a lot of them are already in the chat, which is great. We're talking about things like douches and washes, sprays, powders, wipes, lubricants. The thing that ties all these products together in this category of personal care products, they're all intended to be applied to vaginal and vulvar skin, which is very unique for cosmetics in general. It's a very specific part of our body, and we're going to talk more about why exactly that is so significant. All right, let's go to the next slide. Okay, so let's talk for some further context about why people use intimate care products. And here are some of the main reasons that get reported. The first is fear of vaginal or menstrual odor, and we will talk more about this later in the webinar as well. This is a big one, and it's really largely preyed upon by the companies that make these products. They are desperately wanting you to be worried about this because those fears drive sales, right? And this fear does get internalized by a lot of folks. But I'm here to tell you with all my authority, you all smell beautiful and your vaginas all smell beautiful. So, don't believe it when companies are trying to tell you otherwise. Why else? Cleaning and refreshing. We all like to feel clean and refreshed. This is totally valid. But again, we've got these societal norms telling us this part of our body is dirty, that it's smelly, that it needs extra cleaning. The vagina is kind of like the self-cleaning oven. It really doesn't need any additional help. But again, so many of us feel this need. Because I was told to is a big reason that people use these products. This is, my mom, my sister, my auntie told me this is how you take care of your body, and this is what you do to be a respectable person, right? These voices in our head are very, very real. They're very motivating, and it drives a lot of use. For some people, this is just part of their daily care routine. This is what they do every morning in the shower or whatever. And you don't even think about it when you're using it. Sometimes you're using these products when you're really thinking about it. If you have vaginal symptoms like issues and rashes, this drives a lot of people to use these products to try and self-treat and alleviate some of these symptoms. Now, the unfortunate thing is sometimes use of these products will actually make your symptoms worse in your attempt to make them better. And then lastly, this sort of idea of sexual health or comfort. This is like lubricants, vaginal moisturizers, particularly using those to make yourself feel more comfortable. So there are a lot of varied reasons that people use these products, and then there are a lot of times when people use them as well. So I'm going to talk a little bit about timing of when they most often get used. Before and after sex, this is very often commonly reported that people want to clean up before, clean up after, and are using intimate care products for this purpose. During sex, lubricants are getting used, obviously. During and after menstruation, that's a big one. People are feeling like their periods are messy and they want to clean up afterwards. Again, our culture tells us that periods are dirty, they're shameful, and we need to get rid of the evidence, right? But really, it's a very healthy process, but this is also when people are using these products a lot. After working out or exercising, not uncommon at all for people to bring, feminine sprays or wipes or whatever to the gym after we work out. And I swear this must be coming from advertising too. Somehow they've developed this myth that your vagina will smell more after working out. Particularly yoga gets beat up on in the ads to do this. Like, we all know that this happens. No, we don't all know this. There's literally no research that backs up any of this myth. That working out has any impact whatsoever on vaginal odor. But again, these things get very, very much internalized. And this is when people use these products. You may be, again, using these products to treat vaginal symptoms. So when you have the symptoms, when you're thinking about them most often, you might be using these products, or again, part of your daily care routine every evening, every morning. When you might be doing these. So I just want to show there are a lot of reasons people use these products. Some might be used every day. Sometimes these products are used more than once a day. And this is a concern because it means there's a lot of vaginal and vulvar exposure to the chemical ingredients that are found in these products. Okay, let's go to the next slide. Okay, so why is this important? This is important because vaginal and vulvar exposure to chemicals is so rarely recognized as a real route of chemicals into the body. Now, I love this graphic on this slide that I found, and I mean no disrespect to Emory University's Rollins School of Public Health. It's a great school, but this sort of demonstrates how scientists and public health professionals have thought about chemical exposure for a long time. This is a diagram talking about PFAS exposure, and PFAS are certain kind of toxic forever chemicals. And it says very clearly human exposure to PFAS occurs in 3 ways. You can ingest it, which means you eat it or drink it. You can inhale it through your nose or your mouth, or you can absorb it through your skin, right? These are the only ways chemicals get into our body. And I love this example because it's like, and literally there's no exposure below the waist, like everything's from here up, right? Now, this completely ignores this idea of vaginal exposure. And we see this all the time. It's a real blind spot in exposure in science, that this is a way that chemicals can get into the body. But vaginal exposure is very real. Of course, it's only unique to about half the population. It only happens in very specific circumstances, things like intimate care products, menstrual products, or another source of chemical exposure that happens vaginally. But it is a real blind spot. And this means that vaginal exposure is very poorly researched. We really even lack some of the basic understanding of how chemicals are absorbed when you're exposed vaginally, and then where those chemicals go in your body. So there's a handful of studies out there. Some of these studies are showing significantly greater absorption through vaginal tissue than, for example, for outer skin, sometimes 10 to 80 times more absorption. Now, this is pretty important to understand when you've got these exposures. We know from contraception research for things like vaginal contraceptive rings that when you apply hormones and hormonal chemicals vaginally, there's a preferential distribution straight to the uterus. Now, this is very effective for preventing pregnancy, where you want these hormones to go to the uterus. But what about other chemicals that maybe you don't want to go to the uterus? Like, how often is this happening that these chemicals are ending up in parts of our body and parts of our reproductive system where they can, in fact, cause harm? So we really need better research to understand kind of the dynamics of this. And of course, we need to start by recognizing that this chemical route of exposure is very real and worth discussing. Okay, next slide. So the other thing about vaginal exposure that's very unique is the vaginal microbiome. Now, the vaginal microbiome, this is a healthy community of bacteria that's found in the vagina. And it is totally unique to the vagina, unlike any other community of bacteria. I mean, we don't like to think about our bodies kind of crawling with bacteria all the time. They are, that's how we're made, but it's really very specific and unique kinds of bacteria you find in the vagina, different from anywhere else in the body. Particularly, there's a kind of bacteria called lactobacillus that's really important. And it turns out if you have a vaginal microbiome that is largely lactobacillus, like predominantly lactobacillus, your health is going to be better. That is like the healthiest state, because what lactobacillus does, it emits lactic acid. This keeps the vaginal fluid very acidic with a low pH, and that helps prevent the overgrowth of unhealthy bacteria. So if you get unhealthy bacteria overgrowing, or yeast, you get yeast infections. The lactic acid and the lactobacillus prevents that from happening. It's really, really powerful. It's like the vagina's best defense system against these infections. Similarly, with sexually transmitted diseases, say you're exposed to a sexually transmitted disease from a partner, you are much less likely to actually be infected with that disease if you have a healthy vaginal microbiome. So it's a really good defense system. And now that we're able to sort of measure the microbiome better, and this is really kind of in the last, 10, 15 years that we've even been able to do this, studies have looked at the microbiome and then looked at people who have various reproductive health conditions, things like pelvic inflammatory disease, giving birth too early, preterm birth, bacterial vaginosis, even some kinds of cancers like cervical cancer. The people who are experiencing those health conditions are much more likely to have a disrupted vaginal microbiome than people who don't have these conditions. So again, the vaginal microbiome seems to be adding this level of protection, helping you from getting these other conditions as well. So it's incredibly important to keep the vaginal microbiome healthy. And of course, we're here today because we're really concerned that intimate care products may in fact be messing with the vaginal microbiome because of the chemicals that they include. Okay, next slide. So here's a very concrete example of kind of where we are with the science. I want to talk about bacterial vaginosis, commonly called BV. This is an incredibly common condition that people with vaginas experience all the time. And it is a condition where the vaginal microbiome balance is disrupted. It's usually very, very low levels of lactobacillus, all these other things growing. It can be certainly, very, very uncomfortable condition, often painful. We know that BV is more common among intimate care product users. That has been established in a number of studies. Now, what some doctors and even a lot of companies will say that having BV is then causing people to use intimate care products more often because they're treating their symptoms. So it's like the BV is causing this use because people are trying to alleviate their symptoms. Logical possibility. But what doesn't get asked is kind of the flip side. Is it the intimate care product first that is in fact causing the BV by disrupting the vaginal microbiome? Like, it can in fact go both ways. And this is something that science has not been able to tease apart because we're just not concentrating on it enough. I've got a few more examples on the next slide. Okay, so we know that there's a risk of BV, which is this condition where you've got a sort of messed up vaginal microbiome. It's associated with more frequent sexual activity and having more partners. So again, the theories go, the more sex you're having, the more partners you have, your risk of BV goes up. But what does not often get acknowledged is that intimate care product use is also going up when you have more frequent sexual activity. We talked about when people use these products before, after, during sex. The more activity you're having, the more partners you're having, the more likely you're using more intimate care products. So again, which is causing which, right? Another example, women of color have higher rates of BV in studies. Women of color also have higher rates of intimate care product use. So what we want to be asking, it's so important, is how much might this intimate care product use be contributing to these rates of BV by disrupting the vaginal microbiome? And then when they're disrupting the vaginal microbiome, what other health effects, of course, are a result of that, with this, breaking down of the vagina's health system. And these are questions that are not getting asked by companies and generally not getting asked by regulators or scientists, but very, very important to consider for our health. Okay, next slide. Okay, so the reason we're concerned about this is, unfortunately, when we look at the ingredients that are included in intimate care products, and I've read lots of product labels over the years, it's just not that hard to find ingredients that are totally capable of harming the microbiome and killing lactobacillus. And if you want to see some examples, we have a list, I think it was just posted in the chat. We have a list of products on our website highlighting the kinds of ingredients that we're most worried about. That can be doing this, can be killing lactobacillus and harming the microbiome. So what kind of chemicals are these? Preservatives are kind of the big big category. Preservatives are intended to prevent bacteria from growing in the package. So you got a bottle of wash, you got a package of wipes. If you just leave them sort of unattended, they're gonna go mold, or bacteria are in the package, just gonna get gross, right? So we need preservatives for shelf life to make sure these products stay okay. Now, of course, preservatives are designed to kill bacteria. So how many of these preservatives are unintentionally harming the healthy lactobacillus when these products are used in and on your body, right? So we really need better attention to better preservatives that are in fact not harming the vaginal microbiome. The second category, there's a whole realm of these harsh ingredients, which are often actually over-the-counter drugs. Boric acid is one we'll talk about a little bit later. Boric acid is found in Summer's Eve. It is actually a very potent drug used for very persistent yeast infections, right? So it's medicating you in a product that is supposed to be just sort of a cleaning product that's for daily use. There are side effects, and real side effects, to unintentionally medicating yourself. These harsh ingredients do not belong in these products. Octoxinol 9 is another one of them we found in some douches and wipes. This is a potent spermicide. Like, well, maybe okay if you're trying not to get pregnant, but what if you are, right? These are just chemicals that just don't belong in these products. And then the last category is this category of anti-odor ingredients. Again, a lot of this is coming from marketing. They're trying to prey on your fear of odor, so they have these anti-odor ingredients which will kill the odor-causing bacteria. First of all, almost no research on odor-causing bacteria in the vagina and any impact on odor, external odor whatsoever. But people are believing it and looking for it. When those additives are supposedly killing this odor-causing bacteria, what other healthy bacteria are they also killing? And we'll get more into odor in a minute. So the problem with all of this is totally legal, right? There are no regulations to limit or prevent the use of ingredients that can harm the vaginal microbiome. It's just not a consideration that is being regulated. So we do have certainly a lot of work to do to make these products better. But I think at this point, I'm going to kick it back to Jayla to talk some more about the sort of history and context around intimate care product use. So thanks.
Thank you, Alex. And I believe I forgot to mention at the beginning of the presentation. So this is our 201. And so we do have a one-on-one as well, that we kind of went over some of the different targeted marketing and things of that sort, and just like the language that a lot of companies that produce and push out intimate care products use. And so we're kind of going to take a little bit of a deeper dive today and kind of talk about what are some of the systemic discrimination that's happening in that space as well. So carrying on with the conversation of a lot of these odor control intimate care products. Like Alex was saying, many of them are marketed as with the focus of scent or odor control, which ultimately contributes to body shaming, right? First off, like everyone has their own unique scent, whatever that is, and that is from a lot of different factors. However, there's a lot of cultural baggage that can be tied with odor. In some communities are unfairly associated with certain scents, and kind of assumed to have like poor hygiene, poor judgment, and this disproportionately affects women of color who often face harsher scrutiny when it comes to kind of this olfactory discrimination is what I'll call it, which highlights how women can be stigmatized due to their perceived odor or smell based off their racial or ethnic identities. So yeah, that is a little bit about where that has come from. I don't think it's something that is like new today. And actually I'll go a little bit into some of the research behind where these or how this discrimination has manifested into women of color being more likely to use intimate care products, right? So in a 2015 study, which looked at 700 women from the time period of 2001 to 2004 in the US, they found that a higher percentage of Black women reported using vaginal douches and other feminine products than white women. So, this is dating back to, 2015, right? A more recent study that was conducted in the state of California in 2021, studied approximately 350 women from ages 18 to 35 in California, indicated again that Black participants were indicated to having a greater use of intimate care products compared to women of other demographics. So that is just like an example of, in science, the weight of the evidence that we have is like those behavioral opting into using intimate care products and like what that stems down to, right? And so let's take a little bit of a step back. So this slide specifically shows some of the advertising that has been used over time. And so I want and encourage everyone to kind of put in the chat like their reactions to this, because I don't know if all of you might know, but Lysol, once upon a time, Lysol, the cleaning brand Lysol was used or marketed and advertised to women as a way to help with feminine hygiene. So yeah, so the ad that we have on the farthest left is actually from a 1947 Chicago Defender, which is a predominantly Black newspaper, basically saying and promoting that Lysol should be used as like for douching, pretty much. Second, the ad that is in the middle is a female deodorizing spray that also was marketed in, I believe this was from 1982. And it was marketed specifically towards Black women. And then additionally, the ad that is on the farthest right is a 1958 advertisement in the Daily Defender, just again reinforcing the promotion of using Lysol as a vaginal disinfectant, pretty much. So that is historically kind of what how we've kind of seen some of this discrimination manifest within companies and who they market to and all of that jazz. So like I said, feel free to put any reflections or emotions response. I know when I saw that they were saying that Lysol could be used for douching, I was like absolutely appalled. But yeah, it was, yeah, definitely something that happened that I think is really important to name, right? Um, Another thing that I think kind of like is reinforced by some of the advertisements is that African American and Hispanic women do douche more than white women, and then also douching is more common in teens of all races and ethnicities. And I think that it's important to name this because it reflects on the broader sense of how cultural practices and beliefs about cleanliness are like passed down through generations, right? Um, so a lot of the individual choices that we make when it comes to our intimate care products, whether it comes to our personal care products, cosmetics products, are ultimately like passed down, right? So it's really important to understand the cultural narratives and how that shapes our perception of using intimate care products specifically and what some of the health implications to using these products are as well. So, you know, what do we want to do now is include that in the conversation. So next question for discussion that again would love for folks to enter in the chat is what intimate care practices or beliefs have been passed down to you from your own culture, and even when thinking about culture, just your own family. So we'll take a little bit of a minute for folks to reflect on that, and like I said, please feel free to yeah, enter any of those reflections in the chat. Okay, we have someone saying that they've been taught that these types of vaginal products could be harmful, which is good. And it can be like a really interesting question because it's like maybe it's something that we don't think about as much. Like there are certain products that just that I know for me personally have exist within my care routine just because they that's what was around, you know? So yeah, continue to think about that a little bit more and just spark up conversations within your our own communities about like what products are we using and why pretty much. Um, so moving on, we're gonna kind of take all of this information and what do we do with it, right? So here are a couple of recommendations for intimate care products product users is number one, I know Alex mentioned and went over some of the chemicals that are often can often be found in intimate care products. And so I think it's really important to look at the ingredients on the label and make sure that the intimate care products that you're using don't contain any parabens, oxidol-9, or boric acid. And if they do, just question it a little bit, right? Look for fragrance-free products where available. A lot of times we have a lot of fragrance disclosure work going on in this space. And if there's an ingredient that says fragrance, that means that a lot of times companies don't have to disclose what ingredients make up said fragrance. So even if something is marketed to you as this smells like eucalyptus and and dandies, right? Like what is causing it to smell that way? So if that's an opportunity, make sure to look into that as well. Investigate your own personal use of intimate care products. Going back to this question of like, why are you using them? I know that was at the beginning of the slide where Alex mentioned the different reasons that people use them, which is totally fine, right? But just taking like a little audit of why am I using them in this way? And then also just being aware that if you're changing your intimate care products, are you noticing any changes in terms of your health as well? Because that can mean something too. And then asking the hard questions of manufacturers and holding them accountable. I think it is a huge burden for us and consumer, and us as I mean folks that are consumers of intimate care products, to bear the burden of trying to shift through like what products are the best for me, right? So I think it's also really important to hold our companies and manufacturers accountable and asking them how they're assuring that their products are safe and what other practices are they doing to kind of ensure that safety, right? So those are just a couple of recommendations for intimate care product users. And I think on an example of how Women's Voices for the Earth has done this is, so we all know Summer's Eve. So Summer's Eve is a company that is known for producing like vaginal hygiene products and have been for quite some time. They released this product, the Summer's Eve. I think I can't really read the name of it, but it is like an intimate care wash. And they have a wash and they also have a wipe form. And as you could see, it contains boric acid in it, which Alex mentioned in her portion of the presentation, that boric acid is typically used to treat really intense yeast infections, and oftentimes will be like prescribed as like a last solution. It's not something that is intended to be used daily, right? And so one of the things that we've done as an organization is try to hold Summer's Eve accountable for this. And so we sent them a formal letter, just outlining like some of the issues that we have with boric acid being included into a daily wash, and really calling on them to be transparent about the harms that could be potentially associated, not really market a product that has boric acid in it for everyday use, and just to like ultimately remove products like boric acid and other chemicals that might be of concern from products just in general. So we invite you all to take action with us. If you scan the QR code, it'll give you the option to either email or call Summer's Eve executives to share with them why this is an important matter for you. So yeah, inviting everyone to take action on that systemic level as well. Okay. And now we're at the portion of our webinar where we can open it up for question and answer. So let's see if we have any.
I was going to say, there is a question that was in, I sort of typed an answer, but I'm happy to sort of expound on it. The question was asking, and this is actually, I think there were some questions that came in when people registered as well about recommending non-toxic products and which ones are safer. And it's an issue we have with recommending products is it's hard to recommend some products without looking at the entire market. And of course, the entire market is fairly big. So we haven't gone through and looked at every single product. You can see our list that we posted in the chat before of products that we're concerned about that have some ingredients that are pretty toxic, but it's hard to sort of figure out which ones are the safer ones. But I did want to sort of plug water as a product. It's understated power of water, which does an incredible job at cleaning and refreshing. Just rinsing is often all you need to do. So that's certainly something you can think about. And if you're, really sort of wedded to one particular product or another because it fits into your routine, you can think about changing your routine. You can think about just using products less often, which will reduce your exposure to these products as well. So these are easy things you can do without having to, buy something different necessarily. You can just use things less. And then again, think about washing with water is incredibly effective.
Thank you, Alex.
Yeah.
Are there any other questions? I unfortunately cannot see the question and answer.
Got it.
So
I think there were some questions at the when people registered that asked. Someone had also asked about safer alternatives and suggestions on best products. Someone had asked like which one is the worst one, and again, also really hard to compare which product is worse. Obviously, we've got this focus on Summer's Eve and their ultimate odor protection products that contain boric acid right now. That's kind of worst one at the moment, just because we're concentrating on it, and it's a really good example of something that needs to come off the market. Someone had also asked about vaginal steaming as a process and what the harm is there. There's very little research on the impact of vaginal steaming. It really depends on what you're steaming with. Of course, again, it goes back to kind of the vagina being self-cleaning oven, not a necessary process at all for vaginal health. And there certainly is the potential of vaginal steaming to introduce chemicals into the vagina that you might not want there. So like I said, there's not a lot of research on harms and what might happen, but again, it's not a necessary process, and we don't know too much about the ingredients in kind of steaming products. There was also within that question, someone was asking about menstrual cups. And whether or not they're harmful, because they're kind of a very different way of managing your menstruation. Again, not a ton of research, but the research that's out there is pretty good. They seem to be very well tolerated by people. They're generally just made of silicone, which is pretty inert. It's used in a lot of different kind of medical devices in the body. So certainly a very interesting and different form of menstrual sort of product that certainly takes some getting used to. It's not for everybody, but it's we haven't seen a lot of research indicating that these products are harmful. You definitely, choosing a menstrual cup, we encourage just choose the simplest product you can find. So don't look for sort of colors. I've heard of menstrual cups that are scented. You don't want any of those. So just simpler sort of clear silicone is the way to go on that. Let's see for other questions. Feel free to type anything in. Oh, there was another question in the registration also about sex toys, which is interesting, and what the potential impact there is. Again, we did some research on this a little while ago. There was some concern about these chemicals called phthalates, which are they're plasticizers, so in a lot of plastic products, and whether or not they could come off of sex toys particularly. And the little bit of research that we did looked good, that a lot of products were changing. They were becoming phthalate free, which is great. A concern that we do still have, though, is that there are a lot of sex toy cleaners out there. So products specifically designed for cleaning sex toys that are incredibly harsh disinfectants. So things using things called like quaternary ammonium compounds, they're very, very harsh. They can be linked to reproductive harm. So if you're using a very, very harsh disinfectant on a sex toy, residue can be left, and then that residue ends up in your body and can affect your health that way. So again, soap and water is the much better, simpler way to go as far as cleaning sex toys. And the plastics seem to be improving. I know there's a lot of silicone there too, which is also fairly inert. So that's sort of the good news there. You just have to be particularly careful about the cleaning. So yeah. Any other questions? Have been really good ones.
I see an anonymous question that is specifically asking about a product, Babo Botanical Shampoo and Wash.
Okay. Interesting. Mabo Botanicals is not a brand that I know. This is sort of like exactly the reason why we don't recommend products because when we haven't heard of them. So I haven't heard of that brand particularly. I could certainly look it up and get back to you if you email me. Yeah, washing and washing externally. This is a big deal, right? And if you look at any of these, or almost all intimate care products aside from douches, will say for external use only. And this is something that companies actually use as kind of a defense, right? They're like, you're using this externally. And we're like, but what about the impacts, on the vagina? We're like, well, there's no vaginal exposure because you're using it externally. Well, we know that's not the case. A lot of these companies will also sort of promote that they are pH balanced, right? The only important thing about pH balance is whether or not it's pH balance for the internal vagina. So if you're not using it internally, there's no point in pH balance, right? So we know from some surveys and things that even these products that are, branded for external use only are certainly getting used internally. And that's a very real thing that people are doing. And that's what companies have to be responding to. So washing externally is definitely something that you want to do. I'd have to look at the ingredients of that particular wash to see if there are any, particularly harmful preservatives or other products that are chemicals that might be in there. So not familiar with that brand, but worth looking at the ingredients. Right. Okay, there's a question. Oh, interesting about condoms. Yes, this is a very good one. The question is, what about condoms? I noticed a lot of them are lubricated and came across one recently that contained silicone oil. Do you have advice about this and what to look out for in condoms? There's a whole kind of science, and I'm not totally up on all the science around condoms, but yes, condoms that are lubricated, there's all kinds of ingredients in that lubricant which can be of concern. Lubricants particularly, we discussed them a little bit earlier. There's a lot of new research that certain ingredients in lubricant can actually break down vaginal tissue and cause more vaginal irritation, which is a problem. So condoms that are lubricated, often you don't even get the ingredients on what the lubricant is on condoms. There's not a lot of transparency there. So hard to find ones that are better. If they're not lubricated, that might be better because you'll know that there's not a lubrication there. Silicone oil, yeah, it just depends. There's not a lot of research on what silicone oil might do or not. I think the thing with condoms that's most of concern to me is these condoms that have kind of other bells and whistles. So there are ones that are scented or flavored or tingly or whatever. All of those kind of bells and whistles involve chemicals that can be affecting your vaginal microbiome, can be affecting your vaginal tissue. So again, simpler the better is usually the way to go. But that's a great question, probably worthy of its own webinar.
And then I just wanted to add, because not everyone might not know about this resource, and it's not specific to intimate care products, but so the Environmental Working Group does have like a skin deep database where you can look up a product, and I won't say all of the products are on there, but they have a pretty deep database of products where they kind of do a breakdown of like, chemical, if there's any chemicals of concern in there, so that people can be able to like navigate. And so I know there's a few intimate care products that are on there as well. So I can drop that in the chat, and that can kind of help even lay the groundwork for like when deciding to use whatever product it is that I'm using, at least like what types of chemicals or should I look for, and what do they look like on a label. So I dropped the link to the chat, the link to their database in the chat, and I think it's a really good resource when making decisions on what you'd like to use versus what not, even beyond intimate care products.
Absolutely. And I think the skinny deep database probably also doesn't directly look at impacts to the vaginal microbiome, but it will certainly flag a lot of the preservatives that are harmful. So it'll kind of take care of it, but I think it was also not created thinking about that sort of route of exposure either. So yeah, good to know. Let's see. Oh, someone put in the open that the Babo Botanicals brand does have the EWG verified logo. So that's a very good sign. That means EWG has looked at it and verified the ingredients are safer. So definitely a better option for sure. Yeah. That's great. Thanks for putting that in there. Any other questions? I don't think I see any.
Well, if there's not any other questions, which there just might not be right now, but if any come up, like you all are more than welcome to be in community with our organization. And I think it's really helpful to hear other folks share their stories or ask questions because that puts things on our radar as well. So just invite you all to do that beyond this webinar. So we'll go ahead and wrap up. I just have a few things. So we have a couple of raffle prizes that have generously been donated from Lovability, one of our business partners. And we will be raffling off a prize for anyone that completes our webinar evaluation form by October 30th. So that's 1 week from today. You have the option to receive or to be in the drawing to receive either of these two items. So shout out to Lovability and super excited to hear what you all thought about the webinar just in general so that we could keep going and keep making it a space that is hopefully like packed with good information and good conversation for all of you. So we'll go ahead and drop in the chat the link to that eval. In addition to that, we do have a couple of other one-on-one series coming up. So we have our salon products one-on-one series that'll take place on Wednesday, December 11th. And then our cleaning products one-on-one series that'll take place on January 15th. So one in December, one in the new year. But if you enjoyed your time here and want to learn a little bit more about these things in the context of what that looks like in salons or with just cleaning products, join us. We'll drop the link to the registration in the chat as well. And then last but not least, we cannot do this work without all of you. And so if it is in your ability to donate or even share our organization with anyone that you think like our work resonates with, we invite you all to do that. And then also feel free to follow us on Facebook or Instagram and just stay tuned for what we're doing throughout the rest of Vaginal Health Week. So yeah, without further ado, I think that wraps up our webinar today, but thank you everyone so much for attending and we'll see you at the next one.
Thanks so much, everybody. This was great.